They were saying that we let's see. All right. I hope everyone enjoyed their lunches. I know I did. Not that you care, I'm just going to share until everybody gets it here. Right out. Anyways. Okay, so we will go ahead and get started here. So our next presenters are another one of our WCIF member organizations. And so we have here today, Ron Lehto and Marc Bollinger. And Marc, reading your last name now, I actually have some family with the last name, so we could be family, just saying. So Ron Lehto has been practicing in the behavioral health field in Southwest Washington since 1986. He has provided services to children and families, and inpatient and as an outpatient clinician for the past 35 years. And then Marc has worked in Southwest Washington for over 20 years in healthcare. He specializes in the field of behavioral healthcare and healthcare integration. So let us all welcome Ron and Marc. Thank you.
Ready? So thank you everybody for participating. My name is Marc, and I'm going to be trying to drive and do my best as far as the slides, but Ron and I will kind of go back and forth. If anybody has any questions, absolutely, submit those. I did see one question prior, and the question essentially had to do with, how do supervisors who may be, struggling with just basic supervision of staff, address behavioral health issues or other issues in the current environment, well, in general and the current environment. And I think we'll get to some of that later in the slides. I did want to let everybody know that didn't put a lot of footnotes and whatnot in the slides themselves, but all in the resource section. All of the information that's in these slides is there, and much more. So, and we included the links so you can access those. I want to say a little bit about our organization. We are a behavioral health organization. Ron will speak about it as well. We serve basically birth to death, mental health and substance use disorder services as well. And when COVID hit, and that was a big change, so a lot of the information we're sharing is impacted by COVID. We made the decision to continue operations as normal but we mitigated the risks. Our board members include physicians, and we have medical directors. So we continue to deliver services to folks in the office, in the community, in person, and obviously through telehealth also. But we knew that with the pandemic, kind of the stressors that go along with that will increase the need, and access is important, and a lot of people want the kind of face-to-face work. Anyway, so well, here's the pictures of Ron and I. When COVID first hit, Ron, apparently went down into his bunker and found his gas mask, and I was awarded something for being proactive and thinking about the COVID. So the staff made me dress up in that. So that's a little embarrassing, but it is what it is. It's Ron?
Yeah, so I got to let you know that Marc and I are doing this this presentation from two different parts of the region. So we have in our CIHS service area, we have 5 counties that we serve. Cowlitz, Lewis, and Grays Harbor are the most robust, I guess, for our services that we offer. They also have the bigger cities. Most of the area is rural. Pacific and Wahkiakum is very spread out, very rural. Mark and I drive a lot. We put a ton of miles on our car, and he's up in the top part of Grays Harbor. I'm down in Cowlitz today doing this presentation. So he typically likes to stay at the opposite end of the region when we do any presentation or day-to-day operations. So going on to the next slide here, our organization was really intended to fill gaps to serve the most vulnerable population. And we feel it's really imperative that we listen. Matter of fact, my own email address that I have is I am listening, because I feel like we need to listen to our community as we develop programs. So here's an array of our programs that we have. We developed a lot of these programs within the last 3 years. Washington Listens, you'll see down the list there, is a program that was from FEMA that helps us serve during COVID, which is really nice. EAP, or we do employee assistance, and that's probably what you'd like to hear most about, and CISD, critical incident stress debriefings, which we can talk about more later.
So it's back to me, and the next few slides that I'm going to be going over are the basics of kind of behavioral health. A lot of people aren't familiar with behavioral health, or what they do know, they've either, saw newspaper articles or other articles, or have seen on TV, and a lot of that information is relatively new, and there's a lot of stigma that's attached to it, which we'll get to stigma in the future. But the next few slides are important. And this really has to do with, it may be helpful for the people who ask questions about supervisors and how can they support their, how do they support their staff? How do you know when a staff person may be experiencing like a behavioral health issue, or they have a behavioral health need? Because if you think about it, physical health, if you break your arm, I mean, it's pretty clear that something physical, I mean, you can see that the arm is broken, right? But if somebody's experiencing depression or anxiety or something along those lines, it's not as apparent as like a physical injury. So this is kind of behavioral health 101. What I want you to take away from this slide is it's very common. Behavioral health diagnoses, it doesn't discriminate, whether you have, the wealthiest person on the planet or the poorest person, it does not matter. And it's about 20% of the people do have a diagnosable mental health condition. And although that says 1 in 4 people experience depression in their lives, there are studies that say that everybody at some point in their life will meet the criteria for a diagnosable condition. Most people have coping skills and support networks that it makes those conditions much more manageable for that period of time. Another important piece here is 1 in 10 have a diagnosable substance use disorder condition. And during the pandemic, the state puts on a lot of information sharing webinars that substance use or alcohol use and like marijuana sales have steadily increased during this time. So that's just for people to be aware of. Now with behavioral health, there's a lot of different categories, but we're just going to cover the 4 basic ones. I was really happy to hear that mental health first aid is available to folks. We would really encourage agencies to reach out and take advantage of the mental health first aid training. It's really intended for kind of lay people, and it really is a good, simple, straightforward, understandable presentation or training regarding mental health and substance use. But the four main ones that we're going to cover are mood disorders. That's like depression is included in there, anxiety, psychosis, and then substance use disorders. And just as I mentioned before, with the pandemic, COVID has made everything worse. So they've exacerbated the symptoms for people that have been ordinarily able to manage like depression or anxiety, they become overwhelmed at this, their normal coping mechanisms that become overwhelmed. So how we set these up in these slides is really intended for, it was originally intended for when you see people or when you're with people. But we've obviously gone to a lot of remote working arrangements or virtual meetings. And for example, like on this one, it's very hard for me if I'm looking at Ron, his face is about the size of a postage stamp, and I really can't see him in much detail. And obviously our conversations aren't as fluid as they would be if they were in person. But for like mood disorders, for example, if you do have physical contact, or if you're able to do this virtually, you can see some things, and then during the conversation with folks, you may hear. It's really important to observe and listen. That's really what's at the crux of this. So with depression or with a mood disorder, you may literally see changes in appearance. They may ordinarily be dressed really well. They look more disheveled than normal. You notice that they're more withdrawn from people and supports. Their job performance may suffer. And that may look different depending on the type of work that you're doing. And in some cases that you may notice that they're using substances, and some people do use substances during the workday. And or that their behavior, mania is really where the behavior is much more exaggerated, more than typical energy, not sleeping, and kind of everything's ramped up. But what you may hear during conversations with folks is that they're talking about being really tired, or their change in eating habits, eating more, eating less. Sleep is a big one, and we've seen this and we've heard about it, even with some of our employees, that their sleep hygiene is sort of out the window. Whereas your normal routine that you would have kind of even pre-COVID has now changed, and people are sleeping less or feeling tired all the time and finding themselves needing to sleep during the day. Or, obviously, and this is hard, with a lot of the restrictions, things that they've enjoyed, typically they don't even have access to. So not only may they lose interest in things that they ordinarily enjoyed that they can do, they may not be able to even access those. And one of the more serious ones are obviously to listen to people if they're talking about self-harm or suicide. Anxiety, a lot of these you see people change. There's like physical manifestations of this, they'll become flushed, their breathing increases, they may start pacing, shaking, things like that. Or people will avoid situations that they ordinarily wouldn't avoid. Some people have like panic attacks, and it really impacts their ability to, interact with other folks. Or like obsessive compulsive behaviors, those actually become barriers to people completing tasks. A lot of times you may hear that there's rituals involved in it. You hear oftentimes that people will shower multiple times a day. That's kind of a common one. Or wash their hands, everybody's washing their hands more these days, but even prior to COVID, they're washing their hands excessively, or they, check locks or whatever. But things that you may hear if you're talking to them is that they're really telling you that they are more anxious and worried. And it's not just about COVID, which is a real concern for folks, but just general anxiety and worry about things that they typically wouldn't have been upset about. Or they may become obsessed with a specific topic. And we hear a lot of this about COVID, and it's like, where's that fine line of what's normal versus what's abnormal? And they may also tell you that they're having, physical symptoms, a lot of like upset stomach and other ways that their body manages or attempts to manage anxiety. Psychosis. This is one where people sometimes hear or see things that's like hallucinations that aren't there. They may have delusional thinking about things. They become overly suspicious or paranoid, or they just like lose all affect. And that's kind of where it talks about the changes in emotion, that it's not a good match, or it's not congruent with the situation, the conversation. And then some other people that are experiencing psychosis would, they don't have the ability to complete their work. And in most cases, they do withdraw socially from other people, coworkers, family, friends, other natural supports. And things that you may hear, obviously are odd ideas or delusions or things that are that you'd consider to be more paranoia. Or in extreme cases, the kind of word salad, where it's just a bunch of words that are kind of, that they connect, but aren't in any sort of logical, they don't make sense logically. In those cases, and it's not, and Ron, I don't know the specifics. It's like 1 in 1,000 or something along those lines. The general population have like a diagnosis of schizophrenia or something like that. This can be managed very well with medications and other sort of supports in the person's life, but it is something that you would want to address. And the last one, this is a big one, just substance use disorder. I mentioned before that it has increased significantly during COVID. People use substances sometimes to relax, they say, or to cope with day-to-day stress, but it can become a barrier to their functioning and relationships. Some things that you may see, obviously you can't do this in person. I mean, you can't do this virtually, but like smelling alcohol and or substances, on people's breath or on their clothes or whatever, their eyes are dilated or whatnot. Like I couldn't tell if Ron's eyes they just look like little teeny dots now, so I wouldn't be able to do that. You do sometimes, you may notice even virtually that people have slurred speech. And what's pretty common is that people will have, their attendance will be poor. People used to call it like brown bottle flu, beer drinking, they're hungover, can't come in the next day. And that is a difficult conversation to have with folks. And things, if you are talking to folks regularly, depending on your relationship with them, they'll tell you at times that, they're drinking more or using substances, and whether they're legal or not, or misusing prescriptions, for example. Some people may talk about drinking alone regularly, would that be very unusual for them in the past. And obviously there's some things that come from substance use that are legal, DUIs and whatnot. And then other issues like medical is kind of an interesting one, because you can have, or individuals, and this is more has to do with the opiate epidemic, you'll hear stories that people will start out with an injury or a surgery or something like that, and they have pain and they're prescribed pain medications much more frequently before. But then it's very easy to become addicted to these substances, and opiates in particular, whether they're in pill form, or heroin or fentanyl, are very accessible, especially in our region. We know that very well. Ron?
All right. So what do we need to feel well or normal or even okay? So like psychologists and psychiatrists, doctors, educators, they love doing things in threes. You notice that there's distress, stress, and eustress in threes. Well, what is it that it takes for us to feel okay? We need 3 areas as well. We need to know that we're cared about, that we're cared for, and we need to have some intimacy in our lives. And we also need to have some friends or a social piece. Now, most of these have been really severed with COVID because of isolation. If you're talking about, at work, we need to have that social piece with the people we work with, and we need to have 1 or 2 or 3 people that we can connect with. Again, COVID environment hasn't allowed us to do those sort of things. Again, when I've worked with children and families over the years, people tend to need 3 other things. They need to have time together, time alone, and time in groups. Again, with the COVID environment, we haven't had the groups, and even with the, as far as one-on-one time, we haven't had much of that either, with everyone connecting by Zoom and telehealth. It's just very detached. So now talking about 3 types of stress that we have. So heading to the next slide there. There's again 3 types of stress. General stress, are things like, I need to get to work on time. Got to make sure that I get in there. We all have that. It's a daily thing. Make sure we're getting through traffic. We can figure out how to operate the Zoom. That's just general stress. And we've all adapted to that and we take that for granted. It happens every day. Now, the next type of stress that we have is called distress, and it is debilitating. It paralyzes us. It's things like financial issues, divorce, a traumatic event, a loss of a loved one. That usually paralyzes us. Now, there's no third slide, and the reason for that is I wanted you to invent this slide in your own mind, okay? So invent this slide. This is called eustress. It's the third sort of stress, third type of stress, and it is the stress that helps us do better. It's like if we are trying to excel in our work and we have to take some sort of a test, or let's say we're in college and we have to take a test. We're really stressed for that test, but it actually helps us do better, where distress paralyzes us. All right, back to you, Mark.
So, and I think this slide that's up there now, I just look at it as this is a COVID slide, right? Because there can be traumatic events. Finances for just a lot of people have been impacted with businesses closing and whatnot, and then obviously family members, friends who do experience or got COVID, and then that isolation due to the social restrictions and whatnot. And then some people were forced to move, lost housing despite the moratorium. So this is what people are experiencing, just the general population. And it is very challenging. And kind of to a point where Ron was saying about relationships, well, people think, oh, well, you're home with your family. Okay, that's stressful. I actually like going to work because it does give my family a break. A break from each other. And you see a lot of folks that are working remotely. You're with the same people all the time, and even little things that ordinarily wouldn't kind of get under your skin become irritants, and those irritants can become, very distressing in some cases. So speaking of working remotely, well, there are some pros and cons. A lot of different businesses have moved remotely due to the pandemic. Some businesses operated with remote types of jobs prior to. They do say that there's higher productivity, a better work-life balance, healthier lifestyle, overhead savings. Those are more for the business end of things than the individual, and less of a carbon footprint. Well, you think about the people that are doing kind of the remote working, they don't necessarily have offices in their homes or in their apartments or wherever they're living. They have other distractions that are around, pets, kids. I mean, you see these on Zoom meetings all the time where people are, they have a space that they sort of dedicated to do work remotely, but it's not really set. It's not like an office. And it is stressful. So although there are some benefits to the business or the company, that does add some stress onto the individuals. Some of the cons, and this is where it impacts those previous slides, kind of in the Behavioral Health 101, is there are communication gaps, right? People use emails, and a lot of times emails are great for some things, but they're misinterpreted. Texts people use, again, those are oftentimes, you don't necessarily know the underlying meaning behind it. And back to emails, sometimes I'll receive emails and I give a very short answer, and people will assume that because I used a three-word response that somehow I'm irritated. No, I just gave you the answer, and don't read anything into it. And obviously with those mediums, you can't see the other person, and you don't have that opportunity to interact. Also, it's difficult to stay motivated sometimes if you're working remotely, because you're sort of by yourself. You don't have any of those opportunities to interact with other folks. You're sort of responsible for your own schedule. In some cases, it's it's task oriented, or you have a project that that, you know, that's your outcome, but in a lot of work that you're still having to interact with people, you know, phone, Zoom, or email, or whatever form that takes. And you literally have a lack of social interaction. For us, and like Ron was saying, that a lot of us, when we work in an office, we're able to see each other, right? And you always have the, you know, what's going on with your coworkers, you know, they're kind of work friends as well. You're able to kind of do things socially, even at work. That's very important. And those interactions, you can actually see when somebody's, you know, maybe not doing so well. And then you have the opportunity right there to have that conversation. There are some management challenges, and that kind of gets to the, you know, what do supervisors do, you know, when they have a remote workforce or people working remotely, and there's not that frequent touch or contact that they have with their staff. It's tough. You don't know what your people are doing. You can't go down the hallway, check in with them. A lot of times, just due to the technology or the projects that they're working on, they're delayed because of, you know, you have to send things electronically to somebody else who's relying on that. And there's a chain of events, and you'll have these chunks of time that are I would say non-productive, but they're stressful for folks. And this is exceptionally apparent when you're trying to do team projects. You can occasionally get together on Zoom meetings and whatnot, but a lot of times those are hard to set up. And we try to do that in our office when we have to do things remotely. It takes a while to set up a meeting, and they're not, sometimes they happen, you know, 2, 3, 4, 5 days later. And that time is just a delay on the work that they do. These are just kind of coping skills. And, you know, I kind of say, you know, there's some good ones, they could be good, and there's the not so good. Kind of the good ones is, you know, obviously seeking help and natural supports. Those are family, friends, other professionals that people do. And again, that's been limited a little bit by, or made more difficult by COVID. Even seeing, you know, my parents don't live too far away, and I haven't seen them as often as I'd like, right? And when I do, you know, I don't have physical contact with them, even in person's distant, and just you kind of lose that connectedness. Also, you know, sometimes people have a pretty good job, or they do a pretty good job about reframing, kind of turning, you know, a problem into an opportunity, but that's really kind of individual. Some people are really good at relaxation and meditation. That doesn't work for me. Physical activity. Now that's something that I like, but, you know, a lot of gyms were closed down forever. And, you know, we live in Washington and the weather can be terrible. And, you know, I gained my share of COVID weight. Well, that's kind of the eating healthy. It's much more convenient to get fast food and delivery than, you know, to go shopping in stores where people are not necessarily comfortable. And just that general routine that people try to stick to is important. Now, the could be good is literally, and this is kind of a personal thing as well, is that you have to adjust your expectations. You have to understand that things aren't the way they were. Whether that's your, whatever you just, you know, define as your own productivity or your outcomes or your standard, may have to be adjusted given the new working environment. Inventing, this is an important one. And I don't mean yelling inappropriately or anything like that, but sometimes it's just good to get things off your chest. Where I may, you know, call Ron and just vent. I just need him to listen, you know, to kind of what's going on. And as soon as I kind of get that off my chest, it may be a more productive conversation where he could provide some support towards me. The ones that aren't really so good is just absolutely denying it. You know, that, you know, whatever's happening, sometimes people blame themselves and take that all on their shoulders, and it's really not theirs. Some people, they do like self-harming behaviors. And, you know, a common one that people do that people don't even see are people will do cutting, right? And where you can't see, you know, like on their legs and whatnot, to relieve stress or just to feel something. And then obviously a not so good one is the use of substances, you know, alcohol or substances is a coping mechanism, and that kind of starts you down an unhealthy path. Now, the impacts on employee health, this is, you know, pretty common sense, right? So if you have behavioral health symptoms, it's really important that physical health and behavioral health, they're really not separate. They're tied together. It's kind of one and the same. Physical health issues impact your behavioral health, and behavioral health impact your physical health. For those folks that do have kind of underlying, behavioral health conditions, any sort of stress or physical ailments or injuries or whatever have a negative impact and make those mental health symptoms much worse. And then obviously pregnancy complications. And this is a common one that people don't talk about, is sexual dysfunction, right? Mental health conditions and stress and anxiety and all of this can contribute to sexual dysfunction in both men and women. So it's not just a guy thing or not just a woman thing. And then sleep, we talked about that briefly. Sleep hygiene is very important. Everybody's a little bit different on how much sleep you need to kind of get recharged, but oftentimes you can get into a pattern of not enough sleep or too much sleep. And all of this will impact things like obesity, and when your immune system's down, you're more likely to get other sort of viruses and whatnot. And then some people experience dental issues. They sleep clenching their jaws and have other issues there. This is outdated. It doesn't have the last year's impact, but if you're just going to look at this, all those top slides really have to do with the financial impact on businesses, billions of dollars in lost revenue due to absenteeism, the quality of the work and the productivity. You look at the 35% reduction in productivity when people are struggling and not managing their behavioral health issues well. And depression is the leading cause of disability. That's a pretty amazing statistic. And then when you're depressed and you're not managing it, your peak performance is 70% or so. But if businesses or organizations take an active role in providing kind of a wellness program or a health and wellness program, for every dollar you spend, it's like a 4-to-1 return. So even if you don't have a program now, organizations can start, and the benefits for the business will be there, and you'll have a happier, healthier staff or employees. Now this one, I mean, you kind of think about it as a cycle. Everybody wants to be at the wellness end of things. But what we're talking about today is the organization should have some sort of a structure in place where they can identify, when people are not doing well, right? And that's, if you can identify it, it's quicker to get back to the wellness. And sometimes identifying it, like I'll use Ron as the example because I like to use Ron as the example. If I identify that Ron's not doing very well, and that's a piece of it, but if I don't have that conversation with him just to check in and to see how he's doing, it's not going to be as successful. Then it would just be me watching Ron struggle. But then as an employee or another coworker, I'd have to have the resources and services that would potentially be available. So I could have that conversation saying, hey, Ron says he's not doing very well. I could say, hey, have you talked to your primary care doctor? We have EAP, or you could see a private, clinician out in the community. But if you don't provide those resources and let's say Ron's not doing well, Ron can continue to not do well until things become a crisis. Then a crisis, obviously, it can be very detrimental, not only to himself, but it has a negative impact on coworkers in the workplace. And in some cases, tragedies happen. And when a tragedy happens, it impacts more than just the individual, it impacts the whole organization. And Ron, do you want to speak just briefly to what critical incident debriefing is?
Yes, yeah, we provide that. I've responded to that for years. We've typically provided critical incident debriefings to our first responders because they have difficult calls: police, fire, ambulance, 911. 911 has special, circumstances around because they actually hear a lot of things on the radio that they don't necessarily can't put together because they can't see it in person. The types of critical incident debriefings that we provide are, we sometimes go out immediately to the crisis in the workplace. Most often we serve the staff from 2 days to about a week after the event, because that gives enough time for the event to get out of kind of the shock mode. And then we also provide follow-up to make sure everyone is doing well 2-3 weeks after a workplace kind of critical incident. And we can answer any questions about that, at the end if you'd like, but we have responded to many different types.
And I think what's important is kind of that secondary trauma. So a person didn't have to see it or witness it to be traumatized by it or experience that. So it can be kind of a secondary trauma situation for folks. Ron?
All right. So, well, first of all, before I talk about that, can everybody see my my lanyard here? Let me see if is that right
Unless
there?
they have bionic eyes.
Is that upside down or, okay, what it says is Harley Davidson. I love motorcycles, and I'm going to assume, by telling you this, that most of you that are listening to this love motorcycles. So since I can't see you, I'm assuming that everybody's raising their hands and ride and love motorcycles. So I have to tell you, a few years back, I've ridden for a long, long time, but a few years back, I wanted to get into Harley Davidson motorcycles. And that's kind of a niche, it's the loud machines. You got to wear leather. You have to act cool, with the noise and the rumble. So I'm trying as hard as I can to be cool riding the motorcycle. And a Harley. I decided to head for a Harley hangout, just to see what that would be like. So I drove, and again, I am trying so hard to be cool and to, look like the Harley Davidson guy. So they give you rules in Harley Davidson's, people that love those bikes. They say you're not allowed to touch another person's bike. You're not allowed to park very close to the other motorcycle. So I headed to this event, and I'm coming in, and vroom, 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 and I back in, and I think I'm about 4 feet away from the other motorcycles. And if you've ever seen a Harley Davidson event, you have Harleys, like this. So I parked there, and I'm acting cool, trying to blend in, turn off my motorcycle. And then I'm looking over across all the motorcycles. I see this guy that is huge, a gorilla. He must have been about 7 foot tall, had all of the Harley. I mean, visualize, tough, sleeveless. And he looks at me and he yells at me. He goes, you over there. And so I'm looking behind me, it's gotta be somebody else. It can't be me that he's looking at. And slowly, I think I was losing all control of my body functions at that point. He runs to me, and even worse, he picks me up. Now I'm like this, and my feet are dangling, and I'm in a bear hug. I have no idea what's going on, but I think I'm going to die. I'm pretty certain that I'm dead, and I must have parked too close to his motorcycle or something. Of stuff. And I had nobody else that I could, that I could go to. You helped me. We came in for, and that they came in for employee assistance during that time, because employee assistance programs help connect people to their insurance if they need more than what the employee assistance, has. But it extends to kids. He said, you helped me through this. Oh, it touched me. Of course, I had to go home and change my clothes, but touched me. And he is now in the helping professions, a professional person, actually of leadership. So sometimes those things happen weird, but I had to share that with you. Stigma. Part of stigma is the biggest thing that we can do to combat stigma is really to develop ways to talk about it more. We can have community events. We can have health fairs. But the biggest thing, like the story that I just told you, this guy in leadership now goes and tells his own story. And he doesn't feel any shame for telling that story. It is so easy to talk to our friends and family or coworkers and say, hey, we went in for a health checkup. You know, I had my knee checked on, or I had to get my cholesterol. You know, my cholesterol's better now. You know, that is so easy, but it's still hard for us to say, I went and saw my clinician, or I went and saw my therapist. So making that more normalized, I think, and that's an ongoing battle. I think we've come a long way, but we have a long way to go yet. It's going to be baby steps. Yeah, next slide.
Yeah, that
Up, Mark, you're on mute.
yeah, I was trying to navigate and mess things up. So talking about baby steps, I don't know if people have seen What About Bob? You know, it's kind of an interesting movie, but one of the important pieces here, and we put this in here just because if your organization, you know, whether they don't have any sort of a program in place to support wellness, or if they have one and they want to continue to improve that, it doesn't happen overnight, and it does require, you know, baby steps, right? Oops. But promoting wellness as a culture, this is really a top-down approach. So it really requires the support of those in leadership. And again, we mentioned this before, it includes both physical health and behavioral health. And a big piece is really just acknowledging that behavioral health is as important as physical health, and to kind of really normalize that. Organizations have to go through a process for kind of assessing what they have in place currently and assessing their culture. In our organization, that's a process that our human resources department kind of spearheads, but involves other folks. And then you have to have policies and procedures in place that support that. And then you have to look at those and review those regularly and make sure that it's kind of nurtured and monitored ongoing. And this is kind of a touchy one for some folks, but really assessing the workloads of the employees, because workload stress is a big deal. It's not uncommon in an organization, let's say Ron leaves, and the organization says, well, we're just going to save money by not replacing Ron, and you know, we'll just give all of Ron's job to Marc, right? So now Marc's got Marc's job and Ron's job. And there's no kind of recognition that, well, what took two people to do is not really going to be very successful just having a single person. And the other piece is supporting that kind of work-life balance. It's, you know, people should leave work at work and spend time, you know, at home, but that doesn't always happen. It really kind of depends on the role. People to leave work at work and, you know, enjoy their home time or away from work time. The other piece as well is, even if you do have a menu of services that are available to support staff, really determine if they're, you know, a good match for who you're working or who your, you know, employees are. Whether, you know, it's very different having people that do road work, let's say, than people that are in like a finance or accounting office. Their jobs are kind of different, and they may have different needs as far as how you approach or give access to those services. Access is another one. Rural versus urban. Ron described our area. We're hugely rural. I mean, you can drive literally hours to get from one location to another. Do a lot of those things in our organization, and we reassess ours, you know, annually and modify it to ensure that it you know, that our package, if you will, meets the needs of our employees. And again, it doesn't happen overnight. The interventions, again, we kind of talked about this, is the best, the best way to keep employees well is a lot of that prevention. And that's where we're talking about education, educational resources, creating an environment that's a healthy, kind of a safe place for folks to do their job. When you do see, that people are not doing as well, that you have that early intervention and then make treatment, or care, appropriate, no matter what type of treatment that is, and encourage people to access that. And then obviously if people get the care that they need, they're right back to kind of recovery and wellness again. These are just things that we've done at our organization. Again, we didn't really shut down operations. We just modified them to ensure safety. We have, newsletters, monthly newsletters. We call them lunch and learns, where different employees get together. I think we have like 8 sites, kind of satellite sites. So we have people spread all over the place. And it is more challenging to engage folks when they're further away, but it's an important piece to get their feedback. Like we have an employee feedback survey that's confidential, and that's very helpful. We used to, prior to COVID, and we'll have these again, or chair massages. It's kind of a benefit for people participating. And we do, COVID and we have employee education and things like that. And we have different venues to, communicate issues like regarding COVID, about precautions, changes, updates. And it's also important, at least for us, to have employee initiated activities. So we can do things and sort of mandate people to participate, but we encourage kind of employee driven activities as well. Those have been very, very helpful, and all the staff really enjoy those. And what break states are, it's part of it's the work kind of home life balance, and having that separation, but also taking breaks. We encourage that for employees to, if they're getting stuck, overwhelmed, or slowing down, or things have become like a grind, and they have a different task that they can do, they can shift to that task and then shift back. Sometimes you get in a rhythm and it's not as efficient. Insurance and EAP, employee assistance, and and this is not necessarily employees, but it's those kind of in leadership that if something does happen, how would they activate like a critical incident debriefing? And pretty much everybody's really familiar with FMLA and Washington's modifications and reasonable accommodations and whatnot. This is Ron. Do you want to cover this?
You bet. So this is really a slide for us to kind of recap. So if you're going to have any takeaways of our talk here, of course, refer to the slides before, but it's really about paying attention to the people around you, listening and supporting, looking at changes in their behavior. If you do observe somebody that they're just not acting the same that they typically have, you can always refer them to employee assistance, to the primary care, talk to them, find out more, normalize. Right now, during this pandemic, we're all kind of going through a lot of stress, just based on that, and every time you add something to somebody's plate, it's a little bit worse. Find out if they're isolating. In this environment, it is easy to isolate and be detached from your coworkers, detached from your family and friends. Both Mark and I, we love conspiracy theories. We hear a lot of them right now. We want to tell you, at least I want to tell you, that you should only believe the ones that are true, not the ones that are false. Would you agree, Mark?
I would absolutely agree with that.
Yeah. So
before you go to the next slide,
of laughter out there on that.
Before you go to the next slide, Ron,
yeah.
I think this is important just to kind of use examples about how we, at least at our organization, how we've provided some additional support or communication or connections with our kind of coworkers. So we have, supervisory and manager structures in place. We encourage that they are in regular contact. If it's in person, great. If it's not in person, to use, Zoom, FaceTime, whatever that happens to be, frequent calls. And it's not just about work. There's always kind of a checking component just to see how people are doing. We're well aware. I mean, this is kind of our field. We're well aware that, people get stressed and whatnot. And we're also really good at ignoring our own needs as well. But that's great for those being supervised. But then we have the supervisors and managers also. Well, what do they do, right? So then we have the kind of, I will say, the executives or directors above that they do the same thing for their managers. And then eventually you kind of get to the executive team, and we have a really close executive team, and we make it a point to meet in person at least once a week, and we check in that way as well. And part of that is really a trust thing. A lot of us, like I've known Ron for a long time, and our other executive teams for members as well for a very long time. And it's very apparent when if I'm not having a good day, or if I'm not my normal self, or whatever that happens to be, they'll ask, and I have to be able to trust them that I can share, right? And that they would provide the support or guidance or whatever, because sometimes I have a blind spot to myself and I don't necessarily notice it. So you almost have to ask for people to give you the feedback, and also give permission, or be willing, I guess, to give feedback to other folks, and then kind of loop that back all the way around into ensuring that the person is getting whatever support that they need. And sometimes it's not professional help. Sometimes they just want somebody to talk to periodically, that that they wouldn't necessarily have if they're working remotely or whatever.
Great. The next slide is about planning for your mental health retirement. This slide was actually given to us by chiefs of fire departments. They love looking at every step in the process towards your retirement, as far as staying healthy. Now, healthy physically, right? Healthy, not being traumatized by bad calls, and healthy as far as your own mental health. And that's really all one. It's about staying healthy to help others. So applying this to yourself, keeping in mind that when you do retire, you want to be not only physically healthy, but emotionally healthy as well.
And I think, oops.
Go ahead.
Okay, so, and I think for this one as well, that and you hear about this from people that retire. People, like for me, I have this vision of when I'm done, things are going to be awesome, and I get to do all those things that I don't have time to do now, and so on and so forth. Well, I know intellectually that when I retire, I'll have a lot of free time, if you will. But I don't have something attached, or that routine that work provides, right? It does provide, in most cases, social interactions with other folks. It provides a set routine, and there is some benefit to having routine. So when you're planning about, or not just for yourself or other people, that they need to kind of think about, as they plan for retirement, that, what are they going to do with their time? A lot of people, their identity is tied up in the work that they do. So, and that's kind of their sense of self. So they almost have to find something else to, kind of fill that. And a lot of people do that, with volunteering, or, if they have large families, they can occupy themselves with other families and, grandkids or whatever else is going on. But if you don't plan for it, that can be, a traumatic event in itself that is supposed to be a kind of a good thing. It can have some side effects that people don't think about. So we just kind of wanted to bring this up for those folks that are kind of at retirement age. I've got kids, and I'll work forever apparently, because they're like money pits. And following, there's a bunch of references and resources on this. Number 5 on there, this was pre-COVID. We just included CDC's bonus, the zombie apocalypse and preparing for that and what you should do. And then I started to think about it. It's like, oh God, most zombie movies come with like viruses, and that's how it starts. And well, we left it in anyway. But I did want to go to the end. This is a Ron and my's contact information. There's a lot of information that we could have shared. There just wasn't a whole lot of time. I know we're coming up to the end here, but absolutely reach out to us if you want. We'd be more than willing to give much more specifics about what we've done. We've worked at different organizations as well, apart and together. But it's always been a focus on kind of the mental health and physical health being one. And it is a challenge, but it is getting better. Ron talked about the stigma. When I was younger, even watching TV and whatnot, you never saw there was nothing. It just was like not spoken about. And now schools are much more open and being proactive, for and trying to identify youth that may be struggling. And that's kind of a sideways into, some people will come to work and they're stressed about family stuff. And that's something that EAP can be, absolutely a benefit to them. Because sometimes people struggle with separating kind of that work, keeping kind of stuff at home. It bleeds over into work sometimes, and that causes some challenges for folks. But I think that's kind of the end of our presentation. I don't know if people have questions or comments, or you guys could just ask us later if you want. But anyway, some of the resource I did want to say, they actually give you step-by-step approaches that different organizations have taken to embed and kind of foster a wellness program that they've achieved, good outcomes. They did a lot of tracking of their data cost savings, which you get to the finance people, which is important, and the leadership as well. And they've seen the benefits, and they were actually able to demonstrate that, this really is an investment, no matter what you did. And even if you didn't really care about your employees, and you're one of those people that are looking just for the money and the production or whatever that happens to be, it's like, oh, well, you'll get your outcome too. And you'll have a side bonus of having happier employees. They can help make you money or produce your widgets or whatever that happens to be. Anyway.
Oh, it's really white there for a second. Ron and Mark, thank you so much for the information you shared today. I know I definitely learned a lot. And one thing I can add to that is WCIF has many behavioral health resources, but one thing that is left out of that conversation, typically it's like, okay, here, go to EAP, or here's something else. But rarely, I think as an employer or even as a coworker, you are recognizing these behaviors, you're being aware of these behaviors. And, you had mentioned earlier the mental health first aid classes or trainings. We actually just had a couple of those yesterday, and I haven't had a chance to talk with our folks yet about how that went. But from what I know, they speak to this topic as well, just being able to recognize and how you can better assist your employees. Mm-hmm. So thank you again for the information. And I think with that, we will get into
everybody, if at all possible, to participate in a mental health first aid training. I was a trainer before, and they're very informative and they're very user friendly. So
yeah, that's great. Thank you. Okay, well, I think we will move on to the next agenda item here. Looks like we've got a look. Oh, sorry, my screen went down. Okay, there we go. Looks like we've got a sponsor commercial coming up. Kimberly will play that for that. I can't even talk right now. Kimberly will play that for you momentarily. Just to give you a heads up, you may not be able to hear it. She was having some issues with the volume on her end. So if you're not able to hear it, you can go to our sponsor's booth, Willamette Dental Group, and you can view the commercial there. And then when we are back from the commercial, we will take just a quick break. And We will meet back here for the next session at 2:30. All right, take it away, Kimberly.
WCIF 7. We have been providing proactive evidence-based affordable benefits since 2000. We have approximately 50 offices located in Washington, Idaho, and Oregon. All offices offer medical care and specialty care is available in about 3/4 of our offices. So the quality dental care you need is always nearby. Most of our offices are open Monday through Friday from 7 a.m. to 5:30 p.m. and some offices have Saturday appointments available. Normal dental offers 2 different plans on the website. Each plan has diagnostic and preventive percent within office with COVID. On the WCIF high plan, major services are covered in the office with COVID. On the WCIF low plan, major services may have additional coverage with the office visit copay of $15. For orthodontia benefit for both adults and children, you pay the listed copay amount and the rest. Below orthodontia, this benefit is unique. And like the rest of our benefits, this benefit has a limit. For instance, we will cover up to $1,500 towards the cost of the exam. If you have any questions regarding the office with the WCIF, feel free to contact me via phone or email. Find benefit information on the WCIF website. And for more information about us or learn our dental care, please visit www.wcif.com. Thank you for your time.